Uric acid attack. How gout destroys your joints. Introduction. The silent buildup of a painful crisis. Gout is not merely a disease of indulgence or a relic of historical kings. It is a modern-day menace triggered by an overload of uric acid in the bloodstream. This 7,000-word guide will explore how uric acid builds up silently, attacks suddenly, and relentlessly destroys joints if left unchecked. We will uncover its causes, warning signs, stages, damage mechanisms, and available treatments, framed within clear, informative paragraphs. What is uric acid? Uric acid is a byproduct of purines, natural substances found in the body and certain foods. Under normal circumstances, uric acid dissolves in the blood and exits the body through urine. However, when the body produces too much or excretes too little uric acid, it accumulates and forms sharp, needle-like crystals in joints, especially the big toe, a hallmark of gout. Understanding gout. Gout is a form of inflammatory arthritis. It strikes suddenly, often at night, with intense pain, swelling, redness, and tenderness in joints. The most common site is the big toe, but gout can affect other joints like the ankles, knees, elbows, wrists, and fingers. Over time, repeated gout attacks can lead to permanent joint damage. Causes of gout. Gout is primarily caused by hyperuricemia, a condition in which there is too much uric acid in the blood. Several factors contribute to hyperuricemia. Diet. Consuming purine-rich foods like red meat, organ meats and seafood, sugary beverages, and alcohol, especially beer, can raise uric acid levels. Genetics. Family history of gout increases risk. Kidney function. Impaired kidneys may fail to eliminate uric acid efficiently. Medical conditions. High blood pressure, diabetes, obesity, metabolic syndrome, and cardiovascular diseases are linked to elevated uric acid. Medications. Diuretics, low-dose aspirin, and certain immunosuppressants can contribute to hyperuricemia. The destructive journey of gout. Once uric acid crystals deposit in the joints, they trigger the body's immune response. White blood cells attack these crystals, causing inflammation, pain, and swelling. Repeated attacks can cause permanent damage. Tophi formation. Clusters of uric acid crystals form under the skin. Joint erosion. Constant inflammation eats away at cartilage and bone. Chronic gouty arthritis. Persistent pain and joint stiffness develop. Kidney stones. Excess uric acid may also form stones in the urinary tract. Warning signs and symptoms. Early detection is crucial. Common signs of gout include sudden, intense joint pain, often starting at night. Redness, warmth, and swelling in the affected joint. Limited range of motion. Peeling and itching skin as the attack subsides. Without treatment, attacks become more frequent and severe. Gout may begin affecting multiple joints and causing long-term disability. Stages of gout. Gout progresses in 4 stages. 1. Asymptomatic hyperuricemia. High uric acid levels with no symptoms. 2. Acute gout. First attack of intense pain and swelling. 3. Intercritical gout. Symptom-free periods between attacks. 4. Chronic tophaceous gout. Frequent attacks, joint damage, and tophi development. Diagnosis and tests. Doctors diagnose gout through blood tests. Measuring uric acid levels. Joint fluid test. Detecting uric acid crystals under a microscope. X-rays or ultrasound. Revealing joint damage or tophi. Accurate diagnosis is critical to distinguish gout from other forms of arthritis. Treatment options. Treatment aims to relieve pain, reduce inflammation, and lower uric acid levels. Medications for attacks. NSAIDs, like ibuprofen or naproxen. Colchicine. Corticosteroids, oral or injected. Long-term uric acid control. Allopurinol or febuxostat. Reduces production. Probenecid. Increases excretion. Lifestyle modifications. Avoid purine-rich foods and alcohol. Maintain a healthy weight. Stay hydrated. Exercise regularly. Gout complications. Untreated gout can lead to chronic arthritis, joint deformities, kidney stones and kidney damage. Psychological impact due to chronic pain and reduced mobility. Natural remedies and dietary tips. Natural interventions may help manage uric acid levels. Cherries and cherry juice. Coffee and vitamin C supplements. Avoid high fructose corn syrup. Limit red meats, shellfish and organ meats. Favor low-fat dairy, whole grains and vegetables. Living with gout. Daily management. Adopting a gout-friendly lifestyle can improve quality of life. Key strategies include keeping a gout diary to track triggers, regular follow-ups with healthcare providers, using prescribed medication as directed, stress reduction and mindfulness to handle chronic pain, future therapies and research. Scientists are exploring new treatments targeting inflammation and uric acid pathways. Promising therapies include interleukin-1 inhibitors, genetic therapies, microbiome modulation to reduce uric acid production. Conclusion: take control before gout takes over. Gout is a powerful enemy, but it is manageable. Early diagnosis, consistent treatment, and lifestyle changes can halt its destructive course. Understanding the full impact of uric acid on your joints empowers you to fight back effectively. Don't ignore the signs. Gout waits for no one.